31-year-old Tanya Lawlance is like millions of Americans suffering with a constantly achy hip.
I had a lot of hip popping, a lot of joint pain, keeping me from walking, with my son, walking with my husband.
Anti-inflammatories like Celebrex or ibuprofen can ease some pain, but the ultimate solution is often hip resurfacing or replacement surgery. Now there's an alternative.
It is an amazing new intervention that we have.
Dr. Parvizi with Jefferson's Rothman Institute is the only one in the area doing a new type of surgery to preserve the hip.
We are realizing how important it is to try to save the patient's own hip and not replace it if it can be done.
Dr. Parvizi is doing the procedure for two conditions that often lead to arthritic hips. One is for an impingement, where the top of the femur is smoothed out.
And once the bump is moved, the patient can move around without having any impingement.
The other procedure is for a condition called dysplasia. For this, the top bone is turned slightly so the socket isn't so shallow.
Here would be femoral head doesn't have much coverage. Over here, you can see the femoral head is completely supported.
14-year-old Kylie Hamilton is now able to be back on her swim team after having her hip repaired with the new procedure.
I'm getting better.
Kylie had pain from dysplasia. Her hip was surgically repositioned, and it's now held in place with several screws.
I definitely feel better in the water, and in school I feel better walking around and everything.
The new procedures can only be done on people with certain kinds of hip issues. Recovery time varies from days to weeks. It is usually covered by insurance. We have more information at CBS3.com. Click on Health.